Hello, I'm Dr. Christopher Good. I'm a spine surgeon at the Virginia Spine Institute. My specialty is treating patients with complex spinal problems such as spinal deformity or failed previous surgery. And I'm hoping to help you understand a little bit more about the diagnosis of flatback syndrome. Okay, now in terms of understanding flatback syndrome, we need to understand that the spine has a natural curvature. And flatback syndrome is when something goes wrong and the spine loses its curvature. Now when we stand, viewed from the side, everyone normally has an inward curvature of their low back called lordosis or sway back. Now if we look at this picture, this is a perfectly healthy patient. On a side view, we see that their back normally curves in and out, so lordosis and kyphosis. Now, these curves need to balance each other out so that we're able to stand up straight as we live in our daily lives. If something goes wrong to cause a malalignment in the spine where we're unable to stand up straight, that can be extremely painful and limiting for people. And if you've ever want to know what that feels like, try locking your knees and standing forward holding a bowling ball for about 10 minutes, and you'll know how a patient who has flatback syndrome feels every day of their lives. Now, there are a number of reasons why someone may lose the normal curvature of their back. And in fact, losing it a little bit is a normal part of human life because as we age, the discs of our spine start to narrow. And because the discs are in the front of the spine, as they narrow, we naturally lean forward and hunch as time goes on. Now, there's a certain amount of this that's normal living, but a common cause of flatback syndrome, if someone has a surgical procedure, particularly a fusion, that does not properly align the lumbar spine. And unfortunately, this is a very common scenario. So when a surgeon contemplates a fusion, particularly of the low back, it is very important that whatever surgery they do maintains the alignment of the back so the patient can still stand up straight. Because the lumbar spine is really the foundation, even a small change in alignment can turn the patient into the Leaning Tower of Pisa. And that puts a tremendous amount of stress on your back. You can't stand up straight. And then what you end up having to do is overcurve other parts of your back and bend your knees to stand up straight. It can be very limiting. So this picture is meant to show what happens if we have a slight malalignment. And if we just take a small 10-degree change in the spine, look how in this situation the patient's standing up perfectly straight and the red line's falling here. A small change in the middle of the back, we see now they're not standing up straight. But if we make that change at the very base of the spine, and this is where most lumbar fusions are performed, we can see now the patient's head is sitting way out in front of their pelvis and they can't stand up straight. This is called flatback syndrome, and it is typically the result of a fusion procedure that did not restore enough lordosis. Now, anyone who is considering a lumbar fusion procedure, it is critical to factor this in to the choice for any type of fusion procedure. And if we're not realigning the spine properly with simple lumbar fusion procedures, then we're going to be creating problems for patients down the road. And in fact, our research is showing that if people's spines are not realigned well with their first surgery, they're much more likely to wear out their spine above and require more surgery. So in terms of treating flatback syndrome, the most important thing is to work with your surgeon before your first surgery to prevent flatback syndrome. For patients who have these type of symptoms and spinal deformities as a result of spinal malalignment, sometimes a surgical reconstruction to realign the spine is a very good option for them.